Let's talk to Congressman Tim Murphy on the live line, Republican from the 18th Congressional District, about his legislation helping families in mental health crisis. Talking about bad things that happen, shootings and the like, committed apparently by people with serious mental health issues, and they're mental health issues that have not been treated, and they should have been. Congressman Murphy, thanks a lot for being here. Good morning.
Good morning. Good to be with you.
So what's the status of this bill now?
Well, we are meeting today and continuing to have been meeting throughout August to work with both sides of the aisle to come to some detailed agreement. Some of the frustration is there are those who just don't want to see any action at all. We can't figure that out. I've been a psychologist for 40 years, but there's sometimes I just can't read someone's mind. I think this is where politics has become pathological. Some people just don't want to see some success here. That being said, there is a ton of Democrats and Republicans who do want to see us have success on this. But we're going full bore. When we had those recent terrible tragedies, that reporter being shot on camera, with that policeman in Houston being killed, a host of other episodes where someone with serious mental illness not in treatment was being harmed, it helped to put a spotlight on the idea that we need to identify people early, make sure that access to treatment is there, and get them treatment. One of the things that's happening on the gun issue is that some are saying, well, we should be passing more laws to prevent access to weapons. What happens is the laws are in place. As long as you have a situation where people are not willing to have people hospitalized if they're seriously mentally ill and in a breakdown crisis, and the way the law is in Pennsylvania, for example, is they have to have what's called an involuntary commitment, where a judge says you're in a dangerous state here, you have to be in treatment. Those are the only ways you can actually prevent a person from accessing weapons. So our dilemma is, well, some are saying some are saying they don't want anybody ever to be put into involuntary commitment because they're claiming we're violating their rights. The double bind is they can still have access to weapons. So this is part of what we're hammering out here. Even though our bill has nothing to do with involuntary commitment or weapons, it is interesting how that has emerged as an issue here.
And also the issue of personal rights. When you're involuntarily committing somebody, mistakes are made sometimes. And I think people might be worried about that. How do you address that concern?
Well, that's why an involuntary commitment is not just a psychiatrist or psychologist signing a piece of paper. You really have to have a hearing in front of a judge. But what we have to make sure that it is with a judge who understands the mental health community. So, for example, we have a mental health court in Allegheny County. Judge Ozero's there. You can have someone else, a magistrate, who is trained to understand these issues. Secondly, you need psychiatrists, psychologists, and others who have the time, who know the patient, and can work with them. And third, you have to have the facilities there. So once a person has a commitment, they're really getting into a place that can provide that care. We have a dire shortage of beds across the country. And so what happens in many cases, they say, we have no place to put John Doe, let him back out, unless we know absolutely he has been caught in the act of trying to kill someone. That bar is so high and so difficult to reach that we're not providing the care for people early on when they need it. And that's the flaws in the system we have to fix.
A few minutes earlier, you were talking about political motivations in Washington that sometimes you don't understand, but I noticed there's one provision in the bill, correct me if I'm wrong, it would create a new office of the Assistant Secretary for Mental Health and Substance Abuse Disorders, and I guess a lot of Republicans especially are hesitant to add to layers of government where they say the government has too much power and authority right now.
Well, actually, it doesn't work that way. We have a strong Republican support, and even the conservative magazine National Review has come out saying that this is necessary. The reason is we have 112 federal agencies and programs scattered throughout 8 departments of government who are supposed to be doing things in here. There is no accountability for them. They're supposed to meet together. They haven't met in 6 years to work on what they're doing. There's 20 different programs and agencies deal with homelessness. And the idea of having the assistant secretary doesn't spend any more money. It takes over a current agency. But the job of that assistant secretary is to coordinate and evaluate those programs, eliminate the redundant ones, elevate the ones that are solid and working good, distribute the money back to states where the most good can be done. So this person's job, by mandate of Congress and by reporting back to Congress, is actually to make the system more efficient. And that's the key. It actually removes 112 scattered parts of government and organizes them into one.
Let me ask you to give me a 15-second reply to this. When do you expect this bill to be considered by Congress?
This is a daily discussion I have with the Speaker and with leadership and committee, so we're having a meeting today to discuss that more with the Energy and Commerce Committee. It's very frustrating, BJ, and I'm pushing it every day. I don't want to see more tragedies out there for anybody being harmed.
Well, good luck, and thanks a lot for talking with us. I appreciate it.
Thank you very much.
U.S. Congressman Tim Murphy of the 18th Congressional District here in the Pittsburgh area on the Live Line.